Hi friends, Rick Carpenter here. This video is for those who don't have any health insurance, okay? I want to share with you an idea that hopefully will make sense. Now, I understand how unaffordable health insurance can be. It's pretty ridiculous in our society right now. There are some things that you should know, both in terms of options and rights. First of all, options. You can have health insurance or health plan that will allow you to go to the doctor regularly. If you're sick, if you want a wellness checkup, if you need to go to urgent care, you can have a plan that will do something like that for under $70 a month, okay? Why is that important? Because people who go to the doctor are less likely to have major problems later on. It's sort of like taking care of your car. If you get car maintenance done, routinely, then you're less likely to have a major breakdown sometime in the future that's going to cost a lot more money. People who don't take care of themselves and don't see the doctor are more likely to end up with cancer, heart disease, diabetes, kidney failure, a million other problems that can go wrong simply because we haven't been paying attention, okay? So it makes more sense to me that you have a plan to see the doctor regularly than to have nothing at all. Now, as far as your rights are concerned, a plan like this won't cover you if you have to have surgery, if you have to go to the emergency room, have to be admitted to the hospital for any reason. You're on your own. That may not be such a bad thing, because if you don't have a lot of assets to protect, if you haven't had a successful business for a long time and you don't have a great need for a stellar credit rating and things like that, then understand this. Federal law allows anyone to go and receive medical treatment at an emergency room without the ability to pay. You have that right. So if you have one of these catastrophic events happen, go get it taken care of. Yeah, they're probably going to chase you for their money. Yeah, they might affect your credit. The one thing about medical debt, though, is that it doesn't affect your ability to purchase things the way that default on a credit line, like a credit card or a car loan or late mortgage payments or something. Those will affect your ability to get loans. Medical debt doesn't affect you quite as badly, okay? So don't be afraid if you can't afford a full-blown medical insurance plan. Don't be afraid to get a plan that will help you see the doctor, but will leave you on your own if you have to have something major done. You can still have it done, okay? Why is this important? Because if you have a plan that allows you to see the doctor routinely, including over the internet, you're less likely to have the major problems later on in life. That not only serves you now, but it might serve you when you get to be a senior citizen. If you've taken care of yourself in your younger years, you're more likely to be healthy in your older years. So it makes sense to have a plan where you can see the doctor. I recommend this. If you can afford, anywhere from $70 to $100 a month, maybe a couple of hundred per month for the family to be able to see the doctor routinely, go to urgent care, get on the internet and talk to a doctor whenever you need to, and all of the benefits that come with that, including preventive health, contact me. It makes more sense to have something like this because it will not only, like I said, help you now, but it could help you in the future as well with things that hopefully won't show up because you were able to detect them early on. If this makes sense to you, contact me. Let's find a plan that works for you and that will work on a very, very tight budget.